The Ontario government releases their plans for reopening the province. I'm Marco Perry. Welcome to the Perry Platform. I feel like I've began to lose track of the days. If you were to ask me how long have we been in quarantine, self-isolation, and lockdown, I couldn't give you an answer. It feels like it's been a while, but I can't put a number on it. I guess that's what happens when you are trapped inside and your social interaction begins to falter. COVID-19 has really put a damper on just the whole world. Things from the economy, to our social lives, to just being happy have taken a turn for the worse overall. And on top of all that, let's not forget the health consequences and the deaths that have came from it. It's been a pretty bad time. Now, though, we've come to a point where the Ontario government is beginning to see the light at the end of the tunnel. Just this week, they unleashed their 13-page document on how the province can begin to reopen and resume life as we once knew it. Even if you aren't from Ontario, this here could serve as a standard of sorts for other provinces or even other countries to use when trying to figure out how they can reopen too when the time is right. So, as we begin to flip through the pages, the first thing mentioned is that the model that we've been using is showing drastic improvements. They were quite grim at one point, but now, via these increased health protocols that we've been using, it looks like we've effectively curbed the spread to some reasonable degree. The tools that we used to do that were predominantly, number one, staying at home in a form of lockdown, and number two, these heightened hygienic practices that we've all been using, such as washing your hands more often, not touching your face, and social distancing. These have all been good, and we didn't get overrun as some people feared. Since the data has been overall quite positive, maybe now is a good time to start thinking about where we go from here. Staying home came with some fallout. It wasn't like a vacation for everyone. It was depressing. Some people lost their jobs. It wasn't a good time overall. There were some real concerns with continuing to stay home into the future. We all know that the lockdown can't go on indefinitely. There will come a point in time where we have to reopen. Maybe that's now. Before we even get to that though, from the very beginning, it was clear that we would be losing one way or another. On one hand, if you shut down the economy, as we did, you will save lives, you will curb the spread, but there will be economic fallout there. People will lose their jobs. There are millions of Canadians now who are unemployed. And at the same time, it will be quite depressing. You'll have people who are complaining about infringements on their freedom. It will be a pretty spiky road to go on. But you do save the lives. And on the other hand here, if you choose to not do the shutdown, as we saw with places like Sweden, well, maybe you end up having some semblance of a functioning economy, but you might suffer from a higher death rate. More people might get infected than would otherwise. As of right now, there really isn't a clear indicator of which approach was the best, but the one thing you should know is that there wasn't a perfect answer. You were going to lose one way or another. This wasn't a case where we could just pick the right path, which was so obvious and came with all the benefits. We were going to lose economically or via healthcare. One thing was going to suffer, and I do think we made the right choice, to temporarily take the economic sacrifice to ensure the virus's damage was limited. But now, we have to decide, where do we go from here? That can't go on indefinitely. We can't become a country of hermits who just remain at home all the time. We can't simply base our entire expectation of returning to normality on a vaccine, because we don't even know if that's going to happen. We're not too sure if that'll even be made. It seems like there will be one, but as with science, a lot of things are possible. It's also possible too, the COVID-19 virus can mutate and become an entirely different strand within the span of a few months. Then what happens? The vaccines are useless. It seems to me that the best we can do is use all available data and take into account the opinions of our experts when moving forward. Now, we are supposedly, according to the data and the experts' opinions, at a point where we can look towards rebuilding. Ontario's plan has 3 stages. Phase 1 is to protect and support. We are currently in this phase here. This is what's going on right now. Phase 2 is restarting. That's where we could be in a couple of weeks or maybe a month. This is where protocol is loosened a little bit, and we can start resuming the economy and social life to some degree. Phase 3 is a recovery. At this point, restarting would have snowballed, and we will be looking to do things like creating new opportunities for people and building on what we had before. making things better than they were before COVID. So that sounds pretty peachy, but right off the bat, we should make clear the flexibility of the plan. It's not like once we reach one phase, we can only go forward. If something like a second wave occurs, we have to adjust, and that's a real possibility. Right now, the curve is going downwards, but if people come out of their homes all of a sudden and restart living again, that virus can spread to people who weren't infected prior. Now we could be dealing with a ballooning case rate, with more people getting infected than would otherwise. We have to balance the risk and the benefits here. Data will be key in navigating these terrains. If we can recognize that things are going haywire, we have to dial the plan back. It can't just be gung-ho. We can't just say because we committed to reopening the economy, we're going to do it at all costs, regardless of what happens in the environment. That would be folly. There is no sense in getting to phase 3 only to be struck down by another explosion in cases. The process has to be slow and meticulous, but it does have to happen though, at some point. Now, within the report on page 5, they provide a neat timeline as to what has happened thus far. So, in January, COVID-19 came onto our radar. In March, the government began to shut things down. And now in April, we're looking for a light at the end of the tunnel, a way to move forward. So, now back to the plan. How will the government judge when to ease these health measures? When can we raise the public gathering limit? Right now it's at 5, is not too many. When can we open stores again? When can we go back to parks, which currently you can get fined for in some cities? The government proposes 4 key criteria for coming up with an answer to those questions. First of all, they're going to look at the virus spread and containment. If we see consistent week-over-week reductions in the number of new cases, that's a good sign. If we see that untraceable cases are going down, that's another good sign. But why is that a good sign? So, untraceable cases occur when we don't know how somebody got infected. That means that there are areas or sources of coronavirus that we can't determine, that we don't know what's going on with. But if we see that the cases are occurring from expected sources, that we know that there's an outbreak there, you got it from this community, that means that we are informed. It means that there is a reduced likelihood of us being surprised. The more we know, the better we can plan. So of course, the greater the reduction in the unknown amount of cases, the better off we will be. So the gist here is that once the data trends begin to go downward, as we are somewhat seeing now, it grants confidence in moving forward. The second criteria is healthcare capacity. This is what flattening the curve was all about, ensuring we didn't overrun the hospitals. We spread the cases out over a greater period of time to make sure the peak didn't kill us, basically. If we see that we have ample capacity and supplies to take care of people, we can relax measures a little bit. If the hospital, though, is packed, it would be madness to let everyone loose. Naturally, we would see an increase in cases that we can't accommodate for. It comes down to our capacity. If we can take care of more people, we can risk having more people get infected. And that's what happens when we reopen the country. Maybe it's also worth mentioning that nobody should be under any illusions here. COVID-19 still exists. It's not like you can go outside right now with zero risk of getting infected. Once the government says we're going to reopen the country, it doesn't mean that there is no risk to you. There is still going to be risk. More people will get infected because you'll be outside now. What the government is saying to you, though, is that the risks are being accounted for. If we can treat people in the hospital, we can be more flexible because the downside is being taken into account. We have measured for it. But use that knowledge as you will. The choice is yours. Now, the third pillar is somewhat similar, at least at face value. This is the public health system capacity. So you might be wondering, okay, public health system, hospital, what's the difference? If there is a second wave, we would need more than a simple healthcare system. So the hospitals are acting as a reactive measure. You go in there once you are sick. You can't go there preemptively and ask for something. There's nothing for them to give you. There's no vaccine, none of that. Once you are sick, then you will go to the hospital to absorb some of the capacity. But we have to be thinking ahead. We need proactive measures, and that's where the healthcare system comes into play. We need people to be on the ground administering tests. We need people to be just figuring out policy, to be modeling things, to be looking forward. The hospitals will take care of you if things go bad, if you do get sick, but we need people to be in places where they can impact what's going to happen in the future as well. It's the reactive and proactive combination that we do need. So, now the final pillar is essentially tracking ability. Do we have enough testing capacity to detect new outbreaks? It is one thing if we are aware of a bubbling problem, we can deal with that swiftly, versus only realizing it after the dam burst. On one case, you are able to mitigate the issue before it's insurmountable. In the other case, when things are getting too bad because you didn't detect it early enough, well, you might be powerless. Overall, these criteria make sense to me. I think they'll guide us well. Contain the spread, and make sure these systems are ready to help if we face a new wave. That's basically the criteria in a nutshell. No complaints here. If we stick to that, I think we'll be in a good spot. Next, the report explains how exactly reopening would look like if the previous criteria are met. Not everything is going to open at the same time. There is logic to this because not all businesses are created equal. They don't all carry the same level of risk. There's a difference between maybe a company doing yard work where you can socially distance quite effectively, where you are outside, versus a stadium hosting a basketball game. If we're going to reopen major sporting events where people will crowd into a stadium by the thousands, that's vastly more risky than letting people do landscaping. So we have to be wise here with the rollout. At the first stage, you can expect businesses that can swiftly adapt to social distancing protocol to be set free, like maybe these landscaping companies. They also state that parks and outdoor spaces could resume as well, slowly. Next, the next stage after that, they'll begin to widen the net and open more companies, presumably ones that are more risky. Offices and retail, for example, which just naturally come with people in close quarters. That would be quite risky, but at this stage we can handle it, supposedly. Then finally after that, everything will reopen. There will no longer be a closure on anything at all. You can try to do your sports stadium event at this level. Each of the 3 intervals has a 2 to 4 week wait period though. This is where officials will gauge what's going on. They'll look at the data and they'll say, are we okay to move on to the next phase or do we have to cool out for a little bit? You really have only 3 possibilities at each level. You can look at the data and you can figure out if, first of all, things got worse. What do you do then? Well, if the data is showing that things are getting worse, you might want to scale back your plans to go to the next phase because as you open more stuff, things will inherently get worse. If you're already struggling at stage 1, don't even think about going to stage 2, at least not right now. Then the second thing that could happen is the data remains somewhat consistent. It remains the same. The trends carry on. In this case, you can move forward, but slowly. So the waiting period is 2 to 4 weeks. Maybe you don't do it right away at 2 weeks. You wait, go into week 3, go into week 4. If the things remain the same, it indicates to you that the trend is occurring as it would, and reopening didn't have a drastic effect on that. Maybe you can gamble and go on to step 2. Then you have the third possibility, which is things get better. The cases continue to decrease even though you began to reopen. In this case, you can have a lot of confidence in moving on to the next phase. Maybe you only need 2 weeks of waiting time. As you can see, the data will impact how we move forward. Now, here are some considerations to keep in mind as we do reopen. Don't be confused into thinking that things like social distancing and washing your hands are a thing of the past. The goal here is to reclaim some economic value while not jumpstarting another outbreak. We can't do that if we abandon all of our heightened health protocol. Sure, there will be stores open now. You can go to the park. Maybe you can gather in groups of more than 5 people, but you still have to be careful because the virus, as mentioned, is still here. Don't be lulled into a fake sense of security because it seems like things are going back to normal. It's maybe getting closer to normal, but the virus is still there. You can still get it. You can still spread it. And we can still get a second wave. We have to balance these things here. Reopening the economy, making sure that we don't get crippled by a bigger wave than the first one. That would be a disaster and it would reset us back to stage 1. All the way back to the security phase where nothing is open and you are back in lockdown. We don't want that, so be smart with the responsibility. When the government says that we can go back to retail, we can go back to the park, you can meet again in a group of maybe 10 people, do it wisely. Don't go out gung-ho, start partying, making out with everyone, trying to just live up the life that you feel has been lost during the past month or 2. That would be insane. If you want to doom us to another period of lockdown, that's one way to do it. If you want to move forward responsibly, be wise and make sure you stick to the protocol. The second thing to keep in mind is that this easing of protocol doesn't apply equally to everyone. You must think about your individual susceptibility. If you have a pre-existing health condition and COVID-19 still exists, which it will, you might not want to engage in the freedom that's been given back to you. If you are elderly, you might have to think twice about still going out to that park. When the government tells you you can do something, it doesn't mean that you have to do it. If the parks are reopened and there are a lot of people there, but you are still susceptible, if your odds of dying at the hands of COVID-19 are greater due to whatever your circumstance is, don't take the risk. You have to be smart. But if you are young, if you are healthy, that's a different scenario. Maybe you can take some more risk because if you get it, the odds of you dying are greatly lowered. But even then, think about it. Who lives with you? If you are young and you're healthy, but your grandparents are at home, you can still be a carrier. You have to think about it from your own perspective. Don't just do something because you feel like you should. Think about the consequences of doing so. If the risk to you and those around you is low relative to the other people who are more susceptible, then maybe you can be more risky. That's up to you. But if your risk is high, either because you are susceptible or your family is, then think twice about engaging too early. Really, you might need to be in lockdown for a longer period of time versus the healthy young people, and that's fine. The end goal here is to keep you alive. Keep that in mind. Now, the final thing we have to think about is how are people and their attitudes going to shift in the world post-COVID? How are we going to change and how is the government and the world really going to adapt to meet these needs here? The first thing I believe that's going to happen is things like shaking hands. That might be a thing of the past here. There really isn't much benefit to it. It's all downside. For me to shake your hand, it puts me at risk of getting a disease. Maybe not even COVID-19, maybe just the common cold, which will be a consideration in the future. And it also puts you at risk. And what's the point of it? To show respect? To greet somebody? Here's a newsflash. There are other ways to do that are far less risky. Maybe we start bowing. Or we just do something with our eyes. We nod. We salute. These things could happen. It'd be interesting to see how that transpires. And second, I think there's going to be a fundamental shift in the way that we view work culture. People who can work right now are working from home. Working from home is quite beneficial. You save money on gas, which has another effect of helping the environment. Not to mention, it is pretty awesome. Of course, when you overdose on it, where you're working from home all the time with no option to go outside, it can get tedious. But during a regular work period, where you are in the office for 5 days a week, working from home at least once or twice during that period, that could be quite relaxing. To be able to wake up a little bit later, to not have to dress up, to save money on commuting, doing all these things is tremendously beneficial. And if a company can save money on rent by shrinking their office space because people are choosing to work at home, that's a win-win for everyone. I can see that happening. And now, finally, how are things like events going to come back if they ever do? Right now, I don't think things like going to a basketball game or a hockey game are going to be quite popular, even if we reach phase 3 of the reopening plan. I expect people are going to be skeptical, especially without a vaccine. And even with the vaccine, it might still be kind of scary. Maybe this will provide an opportunity for something like esports to really grab the mantle, to really become a number one source of entertainment for just North Americans overall. Watching something like a League of Legends game, you can do that from the comfort of your own home. You don't have to go outside. You don't have to risk getting a disease. And it's pretty much what it's meant for. A platform like Twitch that's centered around just you streaming from your home. Now, of course, with sports you can watch at home too, but that's drastically different. Being in the arena with all the fans, that's what it's meant for. You watching at home is like a secondary tier prize, but esports, they really are meant for you to watch from home. You going to the arena to watch an esports game, of course that does happen to some extent, but it's not the predominant viewing method. It arguably isn't even the best viewing method either. Now, from an economic standpoint, I do think there will be a consequence or a shift in paradigm with the way people view government spending. So we've seen here with these COVID bailouts to the people and to the corporations that the government has spent a tremendous amount of money. People might be wondering, well, what does that do to us? Are there consequences there? Are we going to have to pay this off over a period of time? Do the people become more frugal as a result? Does the government have to ease us into a period of reduced spending to make up the deficit? That could drastically change the way we operate in the world. Something akin to what happened with the Great Depression. The people who grew up during that era were notorious for just being money savers. They lived during a period of great hardship, And even when things got better, they still were worried about it returning to that point. They saved a lot of money. They didn't spend as much because they knew that the economy could fail at any time. And they didn't want to relive the horrors of not knowing where your next meal would come from. Of course, in Canada, we took care of most people, but the effects could still linger. Maybe that changes the way they think about just money and welfare. These things are all speculation, but who knows? If that were to happen, there would be some changes in what we demand from government and what the government is willing to give to us. And of course, finally, the UBI talks are coming up right now. We kind of had a pseudo UBI in Canada. It really wasn't though, because it wasn't universal, but still, giving out a sum of money per month to some people, that's kind of close. Maybe in the future, we reflect on this and we say, maybe there is a need for a UBI. Of course, that debate is quite lengthy. There are a lot of caveats to consider, but that could be something to think about. All these things here could happen. All I know for sure is that we probably won't be the same after COVID-19. This was a traumatic event and it will leave its mark on us. What transpires from that will be interesting to document. So, that now brings us to the end of our conversation for today. If you enjoy the content, be sure to leave a review and share. You can also find me online at perryplatform.org. Thanks for joining me and I'll see you soon.